Hello, it's Patrick Usher here, and I'm an ME-CFS patient, and in this video I'm going to be discussing the best way I have found to boost my blood volume and the improvements this has had in my life. Now, first and foremost, if you aren't familiar with the idea of low blood volume or not having enough blood in illnesses like ME-CFS, POTS, long COVID, I have done a previous video all about why this actually occurs. But if you're completely new to that, it can be the case that some ME-CFS patients are over 1 litre short of the normal amount of blood volume, and many others have a lower blood volume reduction, maybe 400 millilitres, 500 millilitres, but it's extremely common and very characteristic of the illness. Now, the symptoms of low blood volume, from which I used to suffer very badly, can be extremely unpleasant. You can feel like blood isn't getting into your skin or into your muscles or even into your brain, which is a very distinct but unpleasant feeling. You can feel excessive thirst from the lack of blood. And of course, when you don't have enough blood, your cardiovascular system is under significant strain. So your heart's under more strain, hasn't got enough blood to pump. And when you're trying to exercise, your muscles will give up much more quickly because their anaerobic threshold is lowered because of the low blood volume, among many other reasons. And so once upon a time for me, actually, when I was much more clueless about what I was going through, these symptoms were extremely unpleasant and were a nightmare, actually. And at a certain point, as I will talk about some other time, this problem wasn't far off from actually killing me. But these days I have managed to reverse these issues, or shall we say treat them far better. I still have low blood volume, I just manage it in a very effective way. And this is all thanks to starting to use something called Oral Rehydration Solution. Now, you will no doubt, even if you don't take this already, you will no doubt already be aware of Oral Rehydration Solutions, or for short, ORS, because you'll probably have taken these in your life after you've had some vomiting or some diarrhea. You pop down to the chemist and you ask for some ORS. In the UK or Ireland it's called Normalyte. In the US there's all kinds of names for it. These are little sachets of salt, glucose, potassium, sodium citrate, and they're extremely effective at replenishing fluid and in boosting blood volume. So if someone's vomiting, they're losing a lot of fluid. They take this, the fluid and electrolytes gets back into their bloodstream very effectively. What's not been so much appreciated is how wonderful this can be for ME-CFS, long COVID patients, who often don't have enough blood because of their illness. Now, the reason that it actually works so effectively is because of the presence of the glucose in the sachet. So if you were just drinking a sachet full of salt, this would have some effect on boosting blood volume, but it wouldn't be at all as effective or as neat and, I would say, safe. So there's this clever thing in your stomach, in your guts. It's called the sodium glucose cotransporter. And what that means is that when you have a certain presence of glucose and a certain presence of salt that you're ingesting, there's this transporting mechanism in your guts that recognizes this coexistence of the incoming fluid in which there's salt and glucose, and it pulls all of that solution, that salty solution, because of the glucose, neatly into the bloodstream, thereby boosting blood volume. So it's kind of like a bit of a trick, really. Whereas if you were just drinking salty water, that salt would go in and your stomach would be kind of like, well, this is a little confusing. It would take some of it into the bloodstream. Other parts of it, well, it's a whole other topic, really, what happens when you just salt load without glucose. I'm not going to go into it here because I want to keep this video more contained, but I'll talk about it some other time. But it's by no means as effective, and actually it can really dehydrate you if you have a lot of just salt in a normal way. But by doing it this way with the sachets, with the salt and glucose, the salty fluid ends up being very neatly deposited in the bloodstream and remains extracellular, boosting your blood volume. Now, there's been a wonderful study about this back in 2019, I think it was, by Marvin Meadow. I believe it was an NIH study. And he looked at, he took a group of POTS patients, they were adolescents and people in their 20s, and a group of controls. And he gave each group either a saline IV, or he instructed them to drink a litre of oral rehydration solution over about a half an hour. And then he measured their respective blood volumes, their cerebral blood flow to the brain, to see how effective drinking oral rehydration solution is in comparison to having a saline IV, which is obviously very effective for increasing blood volume. I'm going to read two quotations from this paper. And basically, just to cut a long story short, it was found that the ORS was super effective at helping out POTS patients. So first of all, Meadow writes, the rapid beneficial effect of ORS may be caused by increasing blood volume given its efficacy in enhancing consistent and nearly complete fluid and salt absorption through the intestinal salt-glucose co-transport carrier. That's what I just described to you. The effective enteral salt and water transport system, enteral is in the guts, has been employed to combat the catastrophic fluid loss of infectious diarrhea. This is what I mentioned to you before, that this is how it's usually used, or the context in which it's usually used. ORS in POTS may temporarily, of course it'll only be temporary, correct the central hypovolemia, the low blood volume, that has been reported in many subsets of patients with orthostatic intolerance and various types of syncope. Second quotation, giving oral rehydration solution to POTS patients produced effective short-term mitigation of their orthostatic intolerance, presumably by facilitating rapid repletion of salt and water. Within the short time course of this investigation, that's 30 minutes, ORS was at least as effective in decreasing orthostatic intolerance as a saline IV. That is amazing. This supports the use of oral rehydration solution as an easy, safe, practical therapy to mitigate the symptoms associated with chronic orthostatic intolerance. Because ORS is inexpensive, safe, and easily administered, it may be considered as an effective alternative to saline for rapid resolution of symptoms associated with orthostatic intolerance. Is that not all brilliant? This is a fabulous finding. This is not a heavy-duty medication. It's not like taking something that's going to mess you up in a very profound way, potentially. It is simply a clever way in which the body can use electrolytes highly effectively. So there we have it. The study shows it's as effective as a saline IV. Now that's in the context of drinking a litre of ORS over half an hour. So if you're drinking it more slowly, it presumably wouldn't be quite as effective, because as you are taking it in, your kidneys start to filter it out then. So, it goes in and you pee it out. But that process happens more slowly than if you were just drinking normal water. So now that we've looked at the studies there, I'm going to tell you about my experience with oral rehydration solutions. So it was actually reading this study by Meadow that kind of first led me to the idea of trying this. And it was about 3 years ago, and I went out to the local chemist, I bought a box of Normalyte, came back, and over about an hour I drank 600 millilitres. And the difference was profound. I could feel blood getting back into my skin, into my brain. The lights switched back on. My nervous system calmed down, which makes sense because if you're not getting blood to your brain, your nervous system's going to freak out. A lot of people say, the nervous system in ME-CFS is just sensitized. Yeah, but there's lots of reasons why it's sensitized. It's not just a stress response. That calmed down, and I was able to go out and actually just walk up a flight of stairs without stopping. At that point, I was very weak, and I normally had to pause pretty much every step or a second step. So it was just like a light switch. It was amazing. So at that point, I was kind of converted. Now, it took quite some time for me to settle into the routine I have now with ORS, kind of lots of experimentation and so on. But these days what I do is in a day I will drink 3 litres of fluid. 1 litre is normal water, in the process of, it could just be actual water, I could be having a decaf coffee or whatever. And I like to kind of have, maybe when I wake up, about at least a half litre of normal water just to saturate the tissues with that. I find that does me good. And then I switch pretty much to drinking about, over the course of the day, about 2 litres of oral rehydration solution. And that has a marvellous effect. And I want to say that there's something about also when you switch to, at least for the majority of the day and for the majority of your fluids, to just drinking oral rehydration solution that works really well, rather than drinking ORS and then drinking normal water and then drinking ORS and normal water. Because when you do that, you will counteract to some extent the effect of the ORS, because you're drinking more normal water, which is going to pull out the salt you've just ingested in the ORS. So something that I found really helpful was when I started, for a significant part of the day, drinking ORS as the majority of my fluids, and then you're always kind of topping up the blood volume. Now, I don't do what's in the study there, where you drink a litre very quickly over a half hour. I have not tried that. I would like to try it. I may have tried it a few times, not deliberately, like through some contexts in which it made sense for me to do that. And you definitely feel a much quicker blood volume boosting effect. But I'm very happy with the kind of pattern I have at the moment. And so in terms of the benefits I experience of this, well, I'll be honest with you, I've never experienced a more beneficial effect from any supplement ever in relation to ME-CFS. I mean, this has a magical effect on my quality of life and symptoms. Obviously, it's always temporary. My body is not doing this itself. I have to drink this every day in order to maintain the effect. And one day I would hope not to have to drink any of it if I can recover, but for the moment it's super helpful. So what do you feel? You feel the blood getting back, not perfectly because there's other factors going on, but you feel the blood getting more back into your skin, into your muscles, your legs become lighter, the world becomes more solid, like you just feel everything inside you expanding. And the thirst will go down. I want to talk a lot about thirst on this channel. I've done a lot of work on that. I've actually written a book about thirst in ME-CFS, POTS, long COVID. Link down below. It's available as a free download, but that's just briefly to mention. You just feel enormously better. Exercise intolerance improves. And here's something, right? Imagine you're in a crash and you're stapled to the couch and you just, it's like, I can't hardly move my head. I can't. Have to, turn over. It's really hard. When I'm in that situation and I start drinking my Normalyte, well, that's the name of the brand I use. I'll tell you more about that in a moment. I start drinking my Oral Rehydration Solution in the morning. And by the time I get to about 700 millilitres of it, over about an hour and a half, say, something suddenly changes and I can sit up and I can get up and I can go around and do things. I mean, it's literally like that. I am there. I cannot move, right? I'm stuck in a crash. My body is heavy. I'm stapled to the couch or bed. I drink the Normalyte, and then after a certain point, up I get. I feel profoundly better. I know I'm still in a crash, but I can engage in the day much better. I can go and talk to someone. I can read something. I can go around. I can potter. So that's what it does. And this ties in with the point that Professor Nancy Klimas made, a great ME-CFS researcher. And she talked about, imagine this, having a sympathetic doctor if you're going to the ER with ME. But she talks about when her ME patients would go to the emergency room, they're in a very bad crash, she puts them on a saline IV. And to quote from memory a talk that I saw her give, she says, and they perk right up. They perk right up. And that is what happens for me. Again, remember this ORS stuff, as effective as saline IV at boosting blood volume, I perk right up. during a crash. It's great. It really is great. Now, do I have any concerns about drinking so much oral rehydration solution every day? Obviously, most people, they're never going to drink 2 litres of ORS every day of their life. And the truth is I do, because that's not really been studied. So I don't know if I'm doing any long-term damage to myself from doing this. I mean, I hope not. I sometimes worry because people say electrolytes put stress on your kidneys. There's obviously also the amount of glucose in the formulations. At the moment, I'm on a ketogenic diet, so that means that I'm not having a lot of glucose in other contexts, but it's a fair bit of glucose to be having every day, about 28 grams of glucose. And so, yeah, I do worry about that. I don't know. I haven't experienced any kidney pain or anything. My blood sugar has seemed to be okay. But, I do worry about that aspect. It's not been studied. I have no idea. That's the truth. On the flip side, the stress of hypovolemia is awful for the body to deal with, and I think would cause many more problems, really, if you think about how stressful that is. And furthermore, another thing I really say to myself is that in the grand scheme of all the medications one might take, a sachet containing salt, potassium and glucose is probably not the worst thing in the world. So that's kind of how I think about it for now. I don't want to do this forever. I want to recover or get a hell of a lot better, and I don't want to be drinking this stuff. But for now, I find it immensely helpful. I should say that I do this in the context of an otherwise only low moderate salt intake. I'm not drowning my food in salt when I'm eating, as a lot of ME patients do. I really rely on the ORS for the blood volume boosting effect. In some other video, as I mentioned earlier, I will talk more about whether it's actually a good idea to just salt load in the way a lot of patients do, or whether it might be better to have a more normal or even low normal salt intake and rely more on ORS. Now at this point I want to tell you about the brand of ORS that I use. So for almost 2 years now I have used this one. It's the mirror. It's called Normalyte, and it's fabulous. I order it from America. I'm in Europe, so there is a customs cost to that. Now, hopefully, at some point, they're planning on having it available via Amazon Europe, which would be great. But for me, it's worth that extra cost for now. So it is as a company, Normalyte is very much in tune with people with ME-CFS and POTS, because actually the whole product has been designed with them in mind. This is a product specifically for people with these sorts of illnesses, because a lot of times the other kinds of oral rehydration solution are actually, they have preservatives or strained flavorings or whatever, and people with our kinds of illnesses can have a very sensitive stomach, and often those things don't work out well. This formulation is free of crap like that. It's just the basics. I really love it. I think the company is very dedicated towards people with these sorts of illnesses. And I thoroughly recommend this product. So there's a link below if you want to buy Normalyte or check out their website. The link is an affiliate link. I've been affiliated with Normalyte now for about 4 months. If you do want to buy via that affiliate link at no extra cost to you, I will get a small percentage of that sale. But yeah, I thoroughly recommend Normalyte. It is something that has profoundly improved my quality of life on a day-to-day basis. And whatever brand of oral rehydration solution you might like to try, I really hope that this is something that could also work well for you. Obviously, this is not medical advice. I'm just sharing my own experience and the basis for why this might help someone with ME-CFS, POTS or long COVID. But for me, it's been the most helpful thing I've ever found, supplement-wise. Final thing to say is other people use different approaches to increasing blood volume. Some people just eat a lot of salt. Some people have regular saline IVs, like once a week or something. There can be problems with infection over time with something like that. Obviously, it's a bit of a bore. to have to go and get a needle stuck in you all the time. Some people take a medication called desmopressin, which is a synthetic form of antidiuretic hormone. It increases water retention in the body. Obviously, that will boost blood volume. However, I have actually taken that myself as well in the past. The issue with it, I personally think, I'm not saying this applies to everyone, but personally I think that there's such an issue with salt loss in ME-CFS that if you're taking a pill that's actually going to increase water retention, you risk much more than a healthy person developing hyponatremia, low blood sodium. Another medication people take is Fluornef, fludrocortisone, which is a synthetic form of aldosterone, the main salt retention hormone. And some people do very well with that. Some people don't like it. I've never tried it myself. So that's everything to talk about in this video about boosting blood volume and what I have found helpful. Hope it's of interest to you. Please share below what you thought, what you found in relation to boosting blood volume. And yeah, look forward to engaging with you. And until the next video, all the best for now.